KEYNOTE-010 was presented in Singapore and published in Lancet about a year ago. Now we have 1 more year of follow-up. The last report was rather early. Many of the patients hadn't completed a year. Now we have another year's worth of follow-up, and some more mature survival data. And what I showed was that 30% or more of patients enrolled in the trial are alive at 2 years, real survival. So that's huge. Clearly better than docetaxel therapy. Now Pembrolizumab, as you know, has moved to the front line. So now we're looking at combinations. Well, hopefully Pembrolizumab in the front line will work in the 1 to 49% group. Those studies are ongoing. But then, of course, combinations. I'm very interested in my group at Yale at combinations. Pembrolizumab plus a VEGF inhibitor, ramucirumab. We have some studies there. Pembrolizumab plus a CTLA-4 inhibitor. Pembrolizumab plus a targeted agent. So all that has to be looked at. And then, of course, molecular characterization. At this meeting, there'll be talks by Kurt Schauper and Scott Gettinger, who have both looked at samples of responders and non-responders to immunotherapy to identify genetic and immunohistologic characteristics of those who respond and don't respond. And those abstracts, I think, go a long way to telling us what is it about a responder, and if we understand why someone's not responding or becomes resistant, can we make them into a responder with more effective therapy?